people that come to us expect us to put their needs ahead of our own, right? And that's what you're supposed to do as a physician.
Doctors are special creatures. They're motivated that, hey, if I do this, I can help somebody with pain. I can help somebody with disease. I can help somebody live a better life.
They view their employment more than a job, but a purpose. And the purpose is to save lives and make people's lives better.
Thinking about the researchers, the doctors, the surgeons of the past, we always say, we're standing on the shoulders of giants.
Louis Sayre was appointed as the first professor of orthopedic surgery in North America. To us, he is the father of orthopedics in the United States.
If you look at kind of the lineage of those who did apprenticeships with Sayre and then went across the country and started their own official departments of orthopedic surgery, you can truly say that the seed started here at NYU and then spread across the country.
My grandfather, Herman Fraunthal, and his brother, Henry Fraunthal, were born in the 1860s in Wilkesboro, Pennsylvania. They came to New York City after studying at Lehigh University and became medical doctors and trained at Bellevue with Dr. Louis Sayre.
The building of the Hospital for Joint Diseases was actually a commitment to Louis Albert Sayre to build a place committed to the care of orthopedic patients.
I think the Fraunthals incorporated the vision of Louis Sayre. His son, Reginald Sayre, continued the relationship with the Fraunthal that started with his father and became a supporter. And they sought the philanthropy to providing care for those who wouldn't necessarily be able to get that care. They basically set their own path, and that's very unusual.
Marion Fraunthal Sloan was the first female orthopedic surgeon in the US to publish in a peer-reviewed journal. And this is important because women just weren't taken as seriously as men in the field. All of us, whatever health profession you're in, whatever you look like, whatever your last name is, whatever gender you are, whatever race you are, if you are part of this family, you want the family to succeed. And we succeed by taking excellent care of patients.
NYU has really been at the forefront of promoting diversity within orthopedics. And I think the institution, our leadership have done a really amazing job trying to ensure that our outstanding clinicians reflect the great diversity that we have here within New York City. And everybody's here for the exact same thing. We're here to provide outstanding patient care.
We were once told in medical school many, many years ago that as a physician, you should never be the first to try something new or the last one to give up something old. And to a certain extent, that's true. But somebody has to try something new.
Dr. Habush, he worked at the Hospital for Joint Diseases. He was the first one as well to use
acrylic cement,
which
had been previously used in dental applications. He used it to fixate a hip prosthesis. And it's what John Charnley, who eventually perfected the total hip replacement, used as a model.
There is more arthroscopic surgery done in this country today than any other operation. I'm certain of that. And where did it happen? It happened at the Hospital for Joint Diseases.
We realized while we were doing this, we said, by the way, if we can look and see what we're doing, we see the problem, why can't we do something at the same time? And that's arthroscopic surgery.
In the early 60s, we didn't operate on fractures. If you broke your bone, it was placed in a cast. But in Switzerland, they started putting plates and screws in fractures. Who would have thought? That was heretical.
Howard Rosen learned about these techniques. That innovation was mind-blowing.
This institution is an astonishing institution. If you come to Tisch Kimmel, or you go to Langone Orthopedic Hospital, you go to Long Island or Brooklyn, it's all one culture. In an integrated academic medical center,
We have a simple dream without limit. We want to be the very best in teaching, research, and patient care.
There are thousands and thousands and thousands of patients who are benefiting from NYU Langone Orthopedics, either directly or indirectly. And for us, that is the most meaningful aspect of what we do.